Dr. Zee, where we share everyday stories with you, everyday women. Are you ready to hear heart-to-heart key issues that we all face, no matter where we are in the world? So grab your cup of tea and let's welcome your host, author, international speaker, reinvention strategist, and woman that's full of faith in God and mankind, Dr. Zena Arinzi.
Hello, and welcome. Welcome to another episode of A Cup of Tea with me, Dr. Z. Apologies for the late start in just a few minutes over time. Well, 23 minutes over time. Technical issues. I'm thinking whenever you want to go live, something always happens. Either the screen is not showing or something, but we're here now and we have an amazing show for you today. Today is, what day is it today? It's the 16th. Today is the 16th of May. The 16th of May, and yeah, episode 47. Who would have thought? The 8th of December 2023, and now we're on the 16th of May 2025. Today I've got an amazing guest, and I'm just seeing that you can see already. You're not supposed to see who she's going to be, but I can see already flashing. But I've got an amazing guest today, and I'm really looking forward to bringing her on. She's in the green room at the moment, and today we're talking all about health, wellness. Is something that's really something I like a lot, something I talk about a lot. And I don't just talk about it myself. I always make sure that I have experts that are able to speak about it even better than I can. Obviously, yes, I am the reinvention queen. I am the leadership coach, a reinvention leadership coach. I am, the Pan-African Chamber of Commerce in South Africa. I am the chief wellness officer and all that. But there are even people more equipped than I am to talk all things health, wealth, well-being, especially when it comes to women. So my next guest is absolutely phenomenal. I can't wait to bring her. And today we're talking about healing spaces, empowered voices, bridging the gap between medicine, motherhood, and mental health. And my special guest today is none other than dum, drum roll. I'm not going to tell you yet. Let me read her bio. And then we'll take it from there. So my next guest, not going to mention her name yet, is an NHS GP working in the UK. Obviously for GDPR reasons, we don't really say specifically, but she's in the UK, in the south of England, and she's a multi-award winning motivational speaker. She really is. When I first met her, I was bowed over. She's a mentor with a passion for women's health. She's also really passionate and committed to ensuring that women's mental health in particularly is, being amplified so that they can, work and live and exist at an optimum level with regards to their mental health. She's also passionate about advocating for women, especially mothers. I'm a mother, but I don't think it's for people in my age range. But I'll ask her anyway. But she's really passionate about advocating for mothers. She loves spreading love and hope and making people feel empowered despite their current situations and circumstances. This woman, Dr. has featured on platforms like the Metro. If you're here in London, in the UK, the Metro is a newspaper that is a daily newspaper that you get in the morning, free of charge. Lovely newspaper, all sorts of things. She's also been on BBC channels. She's been on BBC Africa, talking about current topics affecting our communities. She's also spoken on platforms addressing local MPs, working with charities and churches to bring about change in education and health. She is the proud founder and the CEO of a community group called Mums Pride CIC. That's at Mums Pride Team on Instagram if you're going to look for it. And this is a platform, especially for mothers from different backgrounds and walks of life, where they can feel safe, supported, and encouraged. I wish this was around during my time. They also provide a wide network of professionals supporting women and empowering them in their chosen aspirations. With this work, she got selected as a United Nations Women Delegate in 2023 and 2024. Absolutely brilliant. Using her platform to amplify women's voices and advocating for their rights. She's also the clinical director and founder of the Community Health Hub. This is an amazing initiative, even if I say so myself. It's an initiative designed to bridge the gap between patients and their GPs. Now, let's face it, how many of you, for those of you in the UK, and it might be similar in other countries where you've got your primary doctor, who is what we call here your GP, and you're talking to your GP, you're trying to explain what's going on, how you feel, and more often than not, they've got maybe 5 minutes or 3 minutes. I don't know how long now, Dr. This person will tell me more, but they've got a few minutes to actually listen to you, and you can only talk about one thing. And so you don't feel, you leave the practice and you don't feel heard, you don't feel understood, and sometimes underlying situations that you're going through get hidden or get missed because so what Dr. Catherine, I've got to tell you her name, I've got to say her name. What Dr. Catherine does is that her organization, the Community Health Hub, it bridges the gap between your GP and and yourself. So patients are able to get consultations, they're able to get advice and guidance in the community, and they can go back to their GP to share that as well. It also educates and supports patients in the best way so that they're able to get the best support they need from an already strained NHS service that we already know about. Now, without further ado, and some of you, if you're new to the show, please just put in the chat wherever you're watching from, whether you're watching on Instagram Live, you're watching on Facebook Live, you're watching on LinkedIn Live, or you're watching on our normal YouTube channel. We've got two. Maybe you're watching on one of them. Wherever you're watching from, please put in. But one of the things that's really key for me is I do this show. It's a passion project of mine. A cup of tea with Dr. Z. I love tea. My mum loved tea, and I like tea as well. And it's a way of making sure that women all over the world who are doing extraordinary things, have extraordinary stories, can really have a platform to share what they do, but also use it to empower people at home, women at home, wherever you are, so that you know that no matter what you feel, if you feel that what you're doing is so small, it isn't. It doesn't matter how little or how big it is. We're all in this together, and it's all about making sure that we rise together, we're empowered together, we spotlight together. And it's just, I've been doing this since 2023 December, and I just love it. So anyway, I think I've spoken enough. I need to tell you about my guest. I need to bring her in. This amazing. I can see her smiling here. She's like, what has Dr. Zena said about me? Why has she set me up? The phenomenal Dr. Catherine Benhura. Yay!
Hi.
Hi. Lovely to see you. And I'm so grateful to have you on the show. Yes, we did have some technical issues, but between us, two doctors, a medical doctor, and, a doctor like me, together we were able to sort it out. So fantastic. Dr. Catherine, thank you so much. The first time we met, I was bowled over, and ever since then, I continue to be bowled over. Your smile is so disarming. I can just imagine how safe your patients feel, whether in your GP practice or at the Community Health Hub. I think you do that once a month or twice a month, with other doctors, or even in your Mother's Pride thing. You have this welcoming aura, and I don't like the word aura, I'm a Christian, but I don't know what other word, welcoming thing about you that I'm sure makes everyone feel very, very comfortable and is able to break barriers and break boundaries. So with that, my first question to you, because you're like, Dr. Zena, you didn't give me questions. And I was like, I never give questions. It's because I know that you can do this. So my first question to you is, obviously your lovely, lovely smile and your lovely aura, what really, made you sort of think about bridging the gap? Bridging the gap, because you're already doing this. You're already a GP, so I can imagine you spend from morning till night listening to all sorts of things, people that have athlete's feet, or people that have something in their ears, or some little Johnny or Peter or Kweku or Addy that's put a marble down his nose, or you've got
Oh my
an
God.
old lady that's really, really lonely. She comes to the GP and says that she's about to die and she
Mm,
just needs company. So you got a whole and you got people that are rich who really die. You got a whole heap of people. So you got that
mm,
doing, and you've got to manage your home. And then at the weekend again, you go and do the community health hub. And then again, you do Mother's Pride. So what really kind of, led you to do that? What was it?
First of all, thank you so much for inviting me on your platform. I was here smiling in the green room because the way you're describing what I do is honestly is God's grace, and I always give it back to Him first of all. So thank you for what you're doing. As you've mentioned some of your accolades, you only mentioned like the first quarter. You do a lot, and you inspired me the first day that we met as much as, and that's why this is powerful because we're inspiring
Mhm.
each other. And I really appreciate this platform, honestly. Thank you
Thank you.
so much. And yes, started from your first question, why and what brought up the bridging
Mm.
of the gap. So I would count myself to be a woman that looks for solutions. And as a GP, as you rightly said, we spend time talking to many, many different people about anything. And there's still a stigma about coming to your GP just for physical health. But no, we deal with everything. I love the word holistic because we're looking at the whole picture. When it comes to health, you can't separate your physical from your mental. It all goes together in and it also includes the spiritual side of things, really. So we were actually talking, I was with my husband and I, we were talking about, actually, he started it. Let's start with that. He started it saying, I can see that you are going to start something great. And I've always had inside of me that I wanted to start something bigger than what's around me. And I just didn't know why. I did have that fear. I did have that imposter syndrome, and not anymore by God's grace. And we were talking to people in the church who, as soon as you hear, oh, there's a doctor, it's like, I have back pain. So they were coming to me with
I'm,
all the back pain.
I'm one of them. Every single friend I have that is a medical doctor. My ex-husband also was a medical doctor, is a medical doctor as well. So it's like, oh, my head, my back. So yeah, we
So yeah, they were coming to me with different medical problems. And as we were speaking, we thought, well, how about we do this officially? How about we create a health clinic? And the way we're bridging that gap is mainly time. I think I can speak on behalf of many people as a patient myself, is that we need the doctor's time. I grew up in Italy where you have one GP, one family doctor that follows you from birth till you're 13. And after that is the general practitioner. So we never had the problem of time. There was the problem of waiting, but it was a first come, first serve. You want to see the doctor? We just go and you wait till your turn. And that's how we build rapport. And that's how I've been able to build rapport with a lot of my patients. So we've now created a clinic to give people 20 to 30 minutes. Okay.
you will
You will
get that in
not
your
get
G.
that.
No.
No, okay, you will not get that anywhere. And I need to highlight as well, we're doing this for free. Okay, because I know you can get that time privately, and you know how much private health costs, and not everyone can afford that
Yeah.
privilege. So we are giving people the time, the opportunity to speak to a healthcare professional for up to 30 minutes about anything to do with their health. And it's been amazing. The feedback has been so positive, and it confirms the reason why we do what we do. And it's not just doctors. We have nurses, we have midwives, we have health visitors, we have pharmacists, we have obs and gynae specialists, and outside of that, we are also connected to urologists, masseuse ladies. Yes, we had massage at one of our events because we believe that de-stressing is very important, and many more. And we are we are expanding. We're not stopping here. And you're right. At the moment, it is one time per month. It's the last Saturday of every month. At the moment, we're based in Charlton. So please go on our website to book in. It's a very easy way to actually book your appointment, and you can choose who you want to see and what reason you're seeing them for. What we are planning to do is to expand, because we know that not everybody can get to Charlton. So some consultations are on the phone. But what we want to get to is have a community health hub in every
Yeah.
single town, because it's needed. Everybody needs the help. And we're not taking away from the NHS. We're supporting them because we are strained. I'm actually, not far from my work, one of my workplaces, my work surgeries. And I had to see many patients, and I'm given 10 minutes. 10 minutes is a very short time between welcoming the patient, getting them comfortable, building a rapport with someone they've never seen before most of the times, and then going through their symptoms, a diagnosis, sharing the plan with them, and then seeing them out. 10 minutes goes by really, really fast. And a lot of the time they leave confused. They come back for the same reason, because they didn't feel heard. And it's actually putting more strain on the NHS. Hence why we said, let's bridge that gap. Let's give the patients, our community, more time to educate them, because, and it's said it all the time, knowledge is
Yeah.
power.
Yeah. Yeah.
Lack of knowledge is what kills our
Yes.
people.
Yeah.
It is
Yes.
written,
Yes.
okay? But people die for
Yeah.
lack of knowledge. So we are there giving them the knowledge that God has graced us with, that we've spent many years gathering our experiences, and we're working together to support our people. Because then, if you have the knowledge, you understand more, you don't have to go to your GP so often. You will actually follow the GP's advice this time, because you have confidence in what they said. You have an understanding of the plans, and you feel empowered to take care and charge of your health, especially if it's a chronic, long-term condition
Yes,
you're
yes.
dealing with.
You've made so many, because you've made so many valid points. You really have. And what we don't realize is that everyone at some stage, and this isn't for those of us that are Christians, this isn't a curse. So many people are going, I bind that in the name of Jesus. No, every single person will need. Good evening, Valerie. Good evening, Fikile. Everyone in their life is going to need a GP, because obviously primary care
Yes.
starts from your GP. I won't talk about your next door neighbor, your brother, your sister, because we all tend to do that first. When you do it officially, because any good doctor will tell you, and just like a good lawyer, I always say when they come to me, I'm giving you this advice, but please go and see a lawyer. Please go and see your GP. So you're absolutely correct. I go to my GP. If I like my GP, my GP, if I like the actual GP, we're talking, we're laughing. We know he's going to hear me or she's going to hear me. They're going to know exactly what I need before I say. If I go to another GP in the same practice and there's no rapport, I've closed down. And this is me with all my education and all my enlightenment. I closed down. And then I leave that session or that GP clinic feeling unheard, feeling
Yeah.
sick, feeling maybe not even telling the truth of everything that's wrong with me, because I'm thinking, well, she's not going to listen anyway. He's not going to listen, especially if, obviously things like medicine is a very elitist profession for obvious reasons, the brain and everything else. And in the olden days it was rich people that used to do. Obviously now it's more about your brain, which is fantastic. And so there will be lots of people that come in and already feel kind of backward even before they start. So they've already got the imposter syndrome on the other side. I'm seeing my GP. My GP's not listening to me. My GP thinks I don't know what I'm talking about. My GP's talking down at me. So what did you say is actually wrong with you? Have you? I mean, I've got so many stories, my own stories.
I
I
can
remember
imagine.
years ago. This is just before COVID. I probably was among the first people that had COVID, but we didn't know what it was. So this would have been like
Mm,
January, February. I was coughing incessantly. I couldn't sleep. I lost my taste. I didn't know what was wrong with me.
mm,
And we kept on checking. It wasn't any of the symptoms. So I didn't know. I didn't know what it was. I went to the GP and I was telling the GP, oh, I can't sleep. I haven't slept properly for about 4 days. And the GP said, "Oh, are you still on your regular number?" I said, "Yeah, I've been on this number for years." I said, "Okay, I'm going to send you a link to insomnia." I'm like, hello. I'm a grown, using what the Americans like to say, I'm a grown ass woman. I was a grown ass woman even then. I know how my body is. I'm telling you, I haven't slept. It's just a wonder, maybe because I was older then. If probably it was about 20 years ago, maybe they would have removed me from the GP practice as being disruptive, but but I had to go with God. But I was so upset. And she said, "Well, if it keeps continuing, come back next week." I'm thinking, I've just told you I haven't slept for 4 days. That's not normal. I'm not on drugs. I don't smoke, and all that. And then the next week was lockdown. I still remember that 5 years later. I still remember that as not being heard. As so every time I see that particular GP, although I love my practice, every time I see that particular GP, I'm like, I don't want to see her. Yeah, because she was, and there are so many patients that have that experience, and then also the pressure that GPs are under. The NHS, like you rightly said, is overstretched. They have 10 minutes. So those of us that know about the 10 minutes, we're going in, we're thinking, oh God, it's only 10 minutes. What are we going to say? By the time you open your mouth, 10 minutes is gone. Or you want to say about three things. Someone like me that doesn't like going to the GP, I only go when I think I'm about to die. So I'm thinking, okay, I've got you now, and I want to tell you, I've got this, and they just want to, so something like Community Health Hub is absolutely brilliant, where you get 30 minutes. I hope you're listening, viewers. Please, I will share the link. Please go there, follow them. If it's too far, still follow them, because they're doing it all over the UK. And eventually this is going to be global. It's going to be global, because this is something where everybody is going to be a patient and you want to be heard. It's all right when you're on the other side. But when I was speaking to someone the other day, and they were ill, and they were in A&E for how many hours? And this is someone that's a doctor. So everyone, so none of us are. Yes, health. Yeah. So thank you so much for sharing that. I also like, you talking about making sure that we are able to take control of our health decisions, are able to take control, because we're more informed by having a whole 30 minutes to talk about the different things we're going through, and all that. And then you go back to your GP, you go back to if you're going to further, you're going to your surgeon or your consultant. At least you're armed with the right information, so when they're asking you questions, you're not being railroaded. You're saying this is it, and you're not saying I didn't do Dr. Google, because the new thing is, you go to the GP and the GP says, I hope you haven't Dr. Googled me, so all that. Anyway, my next question to you, thank you so much for that, is you've given us a flavor of why for this, to ensure that people get the support and the help that they, especially, people that look like us. But another I want to ask you is, what kind of challenges have you found, because I know, and I'm talking more with regards to mothers, because I'll come back to the community hub, but I'm interested in terms of mothers. So much of your work centers around that. So what kind of challenges do you think mothers face, and why is it important to ensure that you create a space and support systems that are just for them?
So that's a really good question, and I think it's quite broad as well. We've been running the Mums Pride group for 10 years now. It's coming up to 10 years. I know. It's coming up to 10 years. And I can say that challenges change depending on where you are in the season. But what I will start with the end. The seasons don't last. Okay. So that's to encourage anyone, wherever you are on your journey in motherhood, it won't last. Joy does come in the morning. And when we first started, it was just a support group for us to just chit chat. As mothers, sometimes you feel alone, especially if you just started. But what I did find, first of all, is the need the need for community. That was a challenge, an individual challenge, which is to realize and recognize that you need to not do this by yourself. It takes a village, not just to raise the child, but to raise the mother and to sustain
I
yourself in
like that. I
motherhood,
like that. I love.
you know?
Wow.
And it is funny how we have about 200 plus women in our WhatsApp group. And believe you me when I say 99% of them are Black. Not because that's what we were looking for, but because it was someone's friend, someone's sister, someone's cousin, someone's aunt, and that's how we organically grew. So I have noticed the challenge in our community in, first of all, asking for
Yeah.
help. You know, when someone is asking for any simple question, the first thing they will say is, "Oh, I'm sorry if this is a stupid question," or "I'm really sorry if this is not the right platform." And Mom's Pride, we have an open door policy. Okay, you can come in and you can come out whenever. People have come and people have gone, and they came back, and new people have come. But we have an open door policy because I believe, and this is one of my ministries that I truly believe in, that God has an open door policy too, you know, and you need to have that support through all the stages. So challenges that women have gone through, it will be, yes, health, not just their health, but they're also thinking of their
Yes.
children's health. When is the right time to go to
Yes.
the doctors? When is the right time to call
Yes.
111? When is
Yes.
the right time to take my child to
Yes.
A&E? And we try our best not to give too much of medical
Yes.
advice per se, but we do respond to them. And we have Mom's Pride Doctors Group because we have about 40 women who are doctors and mothers ready to support our group and our community. It's a village. Literally, we talk about who has, my hairdresser or a tailor is what I need. I need to get my nails done. And we want to support our
Yeah.
businesses. And one of the challenges I see as well is when it comes to
Mm.
career in mothers. A lot of women that maybe planned or didn't plan their children and become pregnant, they feel like that's the
Yes.
end.
Yes. Yes.
But like I said
Yeah.
at the beginning, it's a
Yeah.
season,
Yeah.
and you will get through the
Yes.
season with the right help and the right supports that we are
Yes.
trying to give.
Yes.
You know, I have noticed how people change their mindset when they see someone that is going through something similar
Mm.
make it. And I
Yes.
that's why I share
Yes.
my story a
Yes.
lot of the time, because the first thing you would say is,
Yeah.
how did you
Yes.
do that? How
Mm.
can you? How are you
Yeah.
juggling different
Mm.
things?
Mm.
And that's how they get
Yes. Yes.
inspired. That's how they get that
Yes.
encouragement.
Yes.
You
Yes.
know, so it's a power that I recognize and I emphasize on, and I sit on with confidence when it comes to the community work that we
You
do.
know,
So those are the few of the challenges that's
I
yeah.
love it because you're just speaking my language. I remember, like you rightly said, motherhood is really seasonal. You've got when you've just had the baby, you're looking at the baby's breathing, you're just peering over on the cot. Just you won't go away. But if you look away, maybe the baby might die. So you're
Yes,
looking. You're looking, and then you've got
we've all
oh
done
God, I
that.
did it. And then you got the part where you've read every single book, Miriam Stoppard, or all the other books, all the famous people that talk about babies, and that you're reading all the books, and you're trying to do it this way, you're trying to do it this way, and then you've got traditional. Maybe you got your mum or your mother-in-law staying. You do it this way, you do it. So you got that power tussle,
Hmm.
you know, you know. During
Yes,
my time, they did it
yes.
like I'm thinking I'm probably going to do that now. My daughters are 27 and 24. They're not married, not children, but I already can see that will happen, and we're all quite strong-willed, so I can already see that. Like, no, mom, don't tell me. I didn't ask for your help. But you know, so you got all that going on. They, oh, do I lie on the bed? Do I not? Or they said you shouldn't lie on the bed because you don't want to lie on
Hmm.
your baby, but you're tired, and you got all that going on, and then eventually it's like you're
Yes.
back at work, or maybe your breasts are engorged. So maybe you've breastfed and your friend hasn't breastfed, so she's feeling judged, or the baby wasn't
Mm.
able to. You've got all that going on. You have that conversation. Oh, put cabbage, don't put
Yes.
cabbage. Do this express. You got all that going on. Then suddenly it's school run. You've gone back to work.
Yes.
You got your oh
Oh
my
my
days. You got your colleagues
goodness.
without children looking being angry because you've come to work with sick down your jacket or whatever, your child won't go to school.
With breast
Breast
pads in
pad
your
in your
bag.
bag. You want to bring out something. You bring out a breast pad. Like, oh, sorry. And then you got nursery calling you that your child won't settle. Then all of a sudden it's over. You're thinking, and then they're in
Yes.
primary school. Like, why are they in primary school? Who finishes school at 3 o'clock? Why can't they finish at 6 o'clock? You got morning club, breakfast club. You got all that.
Oh my
All that.
goodness.
I'm glad I don't have any of that now. But you got all.
Ah, you're
I
enjoying
really
right
am.
now. You're
I
enjoying the
really am.
fruits
I
of your
can't
work.
believe it. But you've got all that. So it's all seasonal. Then you've got all the things in between. Baby is sick.
Yeah.
You have a miscarriage, baby, all the different things, a baby has a disease, baby is autistic, baby's not autistic, all the different things that happen, in life
On
on
top
top
of
of yours.
yours.
But the thing that I really love, I love all this thing. I love because I've gone through it and I have people. It's you're right. It's motherhood is cyclical. It's seasonal. But what I like the most, that what you just said, is that who raises the mother? Oh my days, I've never heard that. I wish I had that. Who raises the mother? We're so busy trying to be perfect mums. For those that are married, perfect mums and perfect wives or perfect girlfriends. You're trying to live up to all sorts of standards, mother-in-law, mother standard, sister standard, husband, sister, big sister, everything, your next door neighbor in your church, all sorts of standards. But nobody's really
Yeah.
thinking about who raises. It takes a village to raise a child. We hear this. Every single black person knows this statement. Whether you're
Yeah.
African, you're African American, African Caribbean, even if you're brown and you're from Asia, whether you're from South Asia, whether you're from India, any ethnic minority, even from Eastern Europe, where they have similar cultures, we all say it takes a village because we really believe in strong community. But I've never heard anyone talking about raising the mother. I love this. You see, I'm in love with you all over again, Dr. Catherine. You know,
Oh,
and it's
bless
really,
you.
really, really, really true. There's so many mothers that might be listening now or listening on the replay, and we need support. We need to be raised.
Yes.
We need to be raised. There are we haven't done this before. Even if you've had one child and you've had
Mm.
four different children, they're all different. It's
It's
all different.
different. It's
You know,
different. Every child is different, so every season of motherhood
yeah,
will be different. Even if you have people like, oh, can you remember how it was when you had the first? No, that's not it. It didn't work. Like I could use the same formula for my younger child and it won't work because they're different. They're different children, different personality, even skin. Oh, my first one had eczema and it went away at 2. Why she got eczema
yes,
3? Because
it's
she's
different.
different. The same way you are different from your
Yes,
siblings if you have
yes,
any.
yes,
You
absolutely.
know?
And I like when we were talking. I did have a question about what are the common things that mothers are struggling with, but you already touched on it, especially that thing about, I hope I'm not asking a silly question. That is
Yeah.
a big one.
Yeah.
Or, God, people are going to look down on me. Or, how come she looks like she's having a good time? So how come I can't do that? Just things like even knowing how to fold a pushchair, you know, you know,
Oh.
or having to get on the bus and only for the bus driver to tell you only three people or two people, I don't know how many people get on the bus, so you have to come off, and all. There's so many different things,
Mm.
or being told off.
You learn
Yes,
from
being told off.
experience.
So, mum, why did you do that? So, oh, who raises the mum? I love that. I love that. Love that. Love that. Love that. Love
Thank
that.
you.
Love.
It's
I
true.
love
It's
that.
very true. You need people that pour
Mm,
into you and you grow through that season. You grow
mm.
through having your child. Sometimes you grow with your child if you had them quite
Yes.
young,
Yes. Yes.
And whenever you had your first child, you're not the same person as when you're having your
Yes.
second child if you have more than
Yes.
one. You're a bit
Yes.
older. Even if it's 1, 2 years older, you're not the same
Yes.
person as you
Yeah.
were last year. You
You shouldn't
shouldn't be
be.
the same
You
person as you
shouldn't
were
be.
last year.
Absolutely.
You shouldn't be.
Absolutely.
So how are you going to grow if you're going to continuously check yourself? The world is already doing
Yes. Yeah.
that. We don't have to do that for us. And we shouldn't do that for our own brothers and
Yes.
sisters. We shouldn't do that for anyone in the
Absolutely.
community. So that's why when people are like, oh, I hope it's not a silly question, it's like you're already apologizing for
Mm.
growing.
Ah, I like that. I like that. Can you, hope you're listening? Can you hear some nuggets? Some nuggets, some nuggets. First, she said that mothers need to be raised. Who's raising the mother? It takes a village to raise a mother. Then she say, there's nothing like a silly question. If you're asked, I'm gonna use that. I'm gonna use that. I'm using that for my Power 330.
Please go
You know,
ahead.
if you are asking a question, even if it sounds silly, even in your ears, or even if it is other people say it's silly, what are you doing? You are growing. When you ask a question, you
Absolutely.
are progressing, you're growing, you're
Yes.
refining yourself, you're perfecting your craft. Oh my days, I love it. I love it. I
Yes.
love it. I could just teach on that. If I love it. There's nothing like
Absolutely.
a silly question. Ask that question, girl.
Mhm.
Ask that question, because when you're asking that question, you are growing. Oh, hallelujah. Sorry,
Absolutely.
I could take you to church.
Abs-
This is not a church show, but I could. Right. Okay. Let's. Okay. Come on, Zena. I didn't offer you any tea. Uh,
oh,
I've got.
oh,
I think I've
thank
got,
you.
because it's nice and cool outside. I've got lemon and ginger iced. I don't know. Have you got a cup?
I have my bottle of
Oh,
water.
all right. See, GPs. You see. Oh, she thinks I've got too much sugar and honey in it. I have actually. Don't tell anyone. Shh. No worries.
No worries, your
Secrets.
secret's safe.
Right. Okay. So let's bring it down. We're talking about mental health. We hear mental health all the time. People talk about it. People that are not supposed to talk about it. Everyone talks about it. It's like a buzzword, which I find a little bit irritating, because mental health
Mm.
is not a buzzword. Mental health is like physical health. It's like everyone deserves to have optimum health, whether it's in your brain, whether it's in your body, whether it's in your emotions, and so I want to touch on, in your opinion, when we're talking about mental health meets medicine, because we're talking about, obviously, the title of
Mm.
today's episode is Bridging the Gap. So we've touched on motherhood, we've touched on medicine a little bit, and we'll probably come back to that when we talk about the community health hub. But I want to talk about mental health, because I know that you see a lot. I know, and we often separate mental health from physical health. But
Mm.
have you seen the two collide? I mean, I know the answer to this, but you're the expert, and there are lots of people that would want to know this as well. Have you seen the two collide in your patients and in your work?
Every day, every single day. And it collides without their knowledge. And that's why I feel like I have the privilege to highlight it to them. Because many a times I get patients who say, I've been dealing with this physical problem for so long and they can't find the reason. They keep saying it's because I'm anxious, or they're dashing in one side and they don't even realize they're anxious. It's a very broad topic, and it collides every single time because one affects the
Yes,
other. Okay, your physical health is connected to your mental health. And then we're talking about medicine itself. When you say mental health and medicine, people immediately think
yes,
medications.
yes, yes.
Okay. Immediately they think,
Yeah.
oh, the doctor, I don't want to go to
Yeah.
the doctor with this because they want to
You're gonna
give
give
me
me Prozac or
medicines.
something? Yeah,
Um, they're going to give me different things. And although, yes, it is a proven treatment, I always say the medications only help with the balancing of the hormones. They don't remove the problem. They do not remove or solve your problem. And that's why I talk a lot about what are you doing alongside it. Okay, you've been on medications for many years, but what else are you doing? Who is around you? And that's why I'll own up. I do take my time sometimes with mental health patients, especially because it's 10 minutes is not always enough. So I do try and see them again or refer them to community hub. But I do take a little bit of time because you need to read between the lines. Especially if you've never met me before, you may not trust me, you know? So mental health it's the whole
mm,
journey. It's the whole journey. And that's why it's very important as clinicians, smile when you see the
mm,
patient. I even got it today, like, oh, this is the first time I'm seeing someone smiling. We have to help our patients mental health, even if they didn't come
Mm,
with that. So many times someone's talking about a heart problem. And then as they're speaking, I can see they're unsettled. I can see that, I can sometimes even see tears in their eyes that they're trying to keep up. And then I say, how are you really? Or what happened during that time when these symptoms started? Who is around to support you? That's one question I always ask. Who lives at home
mm,
with you? Some people may say, why does she want to know? Well, I am a doctor, so I'm an investigator.
yes,
That's my
yes,
job. I investigate. I need to get to know as much as you in this
yes,
short time as
yes,
possible to
yes,
help you. And I've had to
yes,
explain that
yes.
to people because they're wondering, I came here for a cough. Why are you asking me about who's living with you? Well, because if your cough is stopping you from doing your day to day, it might be
Mm,
frustrating. You may not be able to achieve what you want, and that can make you feel anxious, can make you feel
yes,
low. So medicine is not now what it used to
mm,
be then. Back in the days, people were not even going straight to medicine. They were using diet changes. They were using herbs, and now it goes to the other side because people now get things
yes,
online or they take it from abroad and then they wonder why their blood pressure is now
yes,
going up because medicine is a
yes,
whole thing. I can't treat your anxiety
yes,
only if your blood pressure and your heart rate is going the
yes,
other way. And if maybe you're not eating the right things because what you're eating is stirring up your emotions, it's changing the chemical imbalance. Or if you are getting into your 40s and 50s, I start thinking about menopause because we still don't understand that while your estrogen is
yes,
going down because you're
yes, yes,
perimenopausal, your mood, your
yes,
mental health is extremely
yes,
affected.
yes, yes, yes,
People are
yes,
shocked,
yes,
like, oh, I just thought I'm going through the changes. Well, everything
yes,
is changing. Imagine being an anxious person and then having to deal with your estrogen dipping down on top of
yes,
that. And you would think, and then the first thing you think is, oh, I need to increase my antidepressants or I need to increase my medications. How about we talk about how you're managing the fact that naturally, as a woman, you're going through those
yes,
changes?
yes, yes,
And it's only by listening to our patients carefully that we can pick those things up. And it does come with experience, absolutely. It comes with
yes,
interest as well. It comes with the
yes,
passion to
yes,
help people. What we all wrote on our CV, we want to be doctors because we want to help people. Well, do you really want to
yes,
help
yes,
someone?
yes,
Or do you really just want to tick the box and
yes.
go along?
They look
And
at me.
then, you
Yeah,
know,
yes, yes, yeah.
so that's what's very
I love
important.
this. I'm just thinking. I'm already thinking in my head how I need to bring you back because there are just so many different. I mean, I had an idea of the kind of things I was going to ask, but there are so many different dimensions of. As you're talking, I just see myself like an octopus, and I have different things I want to sort of touch on. I mean, it doesn't help to have ADHD anyway. I
Um,
just, but anyway, I like everything that you said, and thank you so much. But I think a learning point for me, and maybe many people that listen to this on the replay or are listening to this now who are not really in this field or just touch the periphery, is that medication might help to manage the situation, but it's not going to cure the situation. What is there is there. What is there. So there are underlying situations you might need, further interventions, psychological help or psychiatry, whatever it is. But the medication itself is not, and people don't know that. Many people don't know that because, especially in the community, when they go to the GP and oh, see, well, we need, I need to put this, you need to see this, you need to see this.
Oh, bless you.
you
Thank you
know,
so much.
you know, and so it's really, it's most of us, many of us, myself included. If I went to the, I like to be visible, not visible. I do like to be visible, but I like to be transparent because you're right. You said this probably about 10, 15 minutes ago. When you share your story or bits of your story that is in context to what's being discussed, people are more likely to listen or more likely to see they are not alone, which is what I always say. And every time I have I mean, this always happens. I always have something else I can remember that I don't even remember. So I remember years ago, I was married. I think I was going through, a turbulent time in my marriage. The marriage was on its way out, but as a Christian, I wasn't having any of it because the Bible says God hates divorce. So I was holding on to dear life, holding on to my dear husband who didn't want to hold on to me, which is no problem. These things happen, so it's no biggie in that way. And there's no, but what was clear is that I was getting more and more depressed about it, and I didn't know I was depressed. No, I'm a crier. I cry naturally. I cry, watch films. I cry. You talk about that. I cry. I cry all the time. I mean, I cried today on the train in the morning because I saw someone fall down and she was crying, and so I gave her a hug and I cried. So I'm that kind of person. I'm an empath. But I knew I was sad, but I was in denial. I didn't believe. I mean, me depressed. How can I be depressed? No, not me. I'm Dr. Z. I wasn't even Dr. Z then. I'm always lively. No, it can't be me. But I was, and when you talk about stories, when you remember people like Robin Williams, although eventually they found that he had something else, wrong, after, posthumously. But when some people like that are always happy, they're the ones that are able to hide depression even more. You know this more than I do. So I was able to keep up appearances and all that, and I remember going to my GP for something else completely different. This was God, I think it has to be about 20 years ago, and or more. And I was talking about something else completely, and I just burst into tears, and she probably did a one like you. She knew immediately that. So she goes, "Are you all right?" Because I hadn't done that before. I was always that patient that you'd have to try and cut short because I'd always have so much to say and I was laughing and everything. And you're like, trying to kind of edge you out sort of thing. And she, "Are you all right?" And, and I can prescribe something. I didn't go back. I said, "The devil is a liar." I I think I said to her at the time, this was about 22 years ago. I said to her at the time, "Oh, yeah, I just remember that my granddad died." And I was just thinking, I never knew my granddad. But I was so petrified. I just had visions that this woman was going to give me drugs and I was going to be, and we always hear the situation where, and this part is true, where obviously because, African Caribbeans, African, Black people generally are not as understood, mentally, and so you might be over medicated, and so you always have this, I'm going to be like just walking around like this, dazed. So I'm thinking that's not me, that cannot be me. So I just kind of became resilient, and I'm like, I lied to her, and I said, "Oh no, I just suddenly remembered my granddad." And I burst. She said, "Are you sure?" She knew I was lying. She said, "You sure?" I said, yeah. Blah, blah. And I left. I didn't go back. But that told me that that's how I knew I was depressed. And so I had to start doing things myself, I'm that sort of person. But I still didn't understand how bad it was until I went to pick up the children from primary school. Yeah, they were in primary school. And I used to wear a green fleece jacket when Primark was really not a place you wanted to go. And I remember I bought it from Primark. We all go to Primark. I bought it from Primark with a green fleece jacket. It was like £3 or £5, and I used to wear it all the time, and I didn't realize. So I dropped. I think I was in between job roles, contracting or stuff, and I remember dropping the girls at school in this thing, and then when it was time to pick them up, I'll still be in this same fleece jacket and my leggings and go and pick them up. I never knew that they had clocked it, especially my older daughter. And then one day, I think it was after coming back from that GP, I'm like, "Oh, what's happening to me? The devil is a liar." I started praying. I was scared because I could just see. I'm very imaginative. I could just see. Really, I said, "They're going to put me in a straight jacket. They're going to do this." I was so scared. So I think it was the fear more than anything that pushed me to kind of take charge of my life. Not that I did anything, any kind of. I did that. First thing I did was I had a shower. Makeup, I like makeup, but I wasn't wearing makeup there. I didn't know I'd stopped. I had a shower. Pro-minded people are laughing. Had a shower, had put on the makeup, wore my lashes. No, I wasn't wearing lashes there. Had lots of mascara, dressed up really well, perfume. I love perfume. And I went to pick up the girls from school. They said, "Oh, Mom, you look so lovely." And because I wasn't doing that before. I probably wasn't showering to pick up the girls. I didn't know. I didn't know
Mm.
they even picked up. And my oldest daughter, she must have been about 8, maybe 9, maybe 10. She said, "Mommy, never ever wear that fleece jacket again. Never ever wear it." I'm like, okay. And so we took it to the garden and we burnt it.
Wow.
That was the end of that. So that, I think the fear itself was,
Yeah.
yeah, helped me to kind of put things in perspective. But that's not to say that, you know, I know knowing what I know now, that mental health conditions exist, and it's always one in
Exactly.
four. It's always one in four, just like abuse is always one in four. So I thought I'll share that so that people know that it's not just it happens to someone else.
No, it can
It,
happen to anyone.
anybody at any stage in our lives.
And one thing to know is that it can also happen to young children.
Yes,
I'm seeing a
yeah,
lot of young people who are struggling with their mental health.
yes,
So it's something to highlight and be aware, be mindful of, the changes that you may see. Be
mm,
aware of your environment, of your children's environment as well as a mother,
yes,
and start picking things early and start acting on them early. Because I
yes,
think in our community we have that problem of leaving things till late,
yes,
and that's with everything to do with
yes,
health.
yes,
I've also done I was supporting the NHS campaign on cancer symptoms, and we were talking about how high the risk is, and not actually how high the risk is in our community as Black people, but also how high the number is of people that take their time and delay seeing their doctors
yeah,
because they're scared of the big C word.
yes, yes,
And that's why there's a large number of people in our community that
yes,
get diagnosed with late stage
yes,
cancers
yes,
because we leave it till late. That
yes.
fear that you're talking about is what then kills.
Yes, yes, yes. And I could see that because yeah, I can see that because so many people, by the time you hear they said it's stage 4, you're like, but I just saw you last year, or just saw, but
Yeah.
yeah, they would have noticed something quite, but they're like, okay, let's pray it away. Maybe it's not what I think and stuff like that. You're absolutely correct. And then also the stigma, coming back to mental health. I mean, the stigma is everywhere, so it's not just in our community, but it's more in our community. Other
Mm.
communities are moving a little bit, but the stigma is still there. but
Yeah.
but we are even more backward, and that's a negative word, but we're more backward in terms of the stigma, in terms of our faith groups. Whether you're Muslim, it doesn't matter what faith you are, you're thinking, if I pray it away, it will go away. Meet myself inclusive. I tell people now that every single person, if you have the opportunity, needs to have a therapist.
Mm.
You need to have someone that you can offload to, that is not your mom, your next door, your friend, your prayer group. All that's all good, but you need to be able to speak to a professional about
Mm.
something, and you'd be surprised, even if it's just CBT.
Mm.
It's really important. I have daughters, and so it's something that we talk about in our home, in terms of, this is something that we're very, very passionate about, because I've seen things that have happened to me and the way I've dealt with it. And you want to ensure that my daughters are empowered to make the right decisions, and also in their communities they have, like you rightly pointed out, there is so much going on. You're either praying for someone's friend, and because the younger generation, Gen Z's, are not like my generation, Gen X's and millennials, and the one before, whatever they're called, baby boomers, where we would say, "Oh, hi, Dr. Catherine, please, can we pray for Valerie? Valerie and her husband are going through the," and then you just, but we're praying for them. Whereas Gen Z's, my daughter might say, "Oh, mom, can you pray for," I would never know who the person is. So you would know what
Mm.
the condition is, but you won't know what it is. So what I do know is that you're absolutely correct. It's very rife in the
Mm.
younger generation, very, very rife, because they talk about it more openly. They're more open, more transparent. They don't hide these things, unlike the generations before. But
That's true, but and I think it has to be a combined thing. I think I personally can't separate medicine and faith. For me, they come together. Obviously, at my place of work, it's not something that we talk about
mm,
all the time. But I
mm,
do believe, and I think because we've spoken about mental health in the churches,
yes,
that's a
yes,
very big topic. It's a big
yes,
stigma as
yes,
well. So you
yes,
see both sides,
yes,
and I believe that with the right knowledge and the right support, you can heal from things.
yes,
Okay. I have seen conditions that are physical conditions, even like diabetes, high blood pressure, being reversed. Okay. And that's by the lifestyle changes, that's by getting the right treatment, right support, right therapy, and yes, by prayer.
yeah.
Because I don't ever want to diminish the power of prayer,
No,
and it's not but, and I want to empower people to get the knowledge of what you're going through so you can make the right changes while
yes,
you
yes,
pray.
yes,
You pray without ceasing, but you're also working. You
yes,
don't sit on it,
yes,
you
yes,
know so
yes.
they come hand in hand,
They
and it's
do.
biblical.
They
It
do.
comes hand in
They do.
hand.
They do. The Bible says, "In all you're getting, get understanding." You know, and things happen to because lack of knowledge, lack of wisdom. You don't look for it. You're just keeping your head in in the air. So you're right. God has given doctors and other experts, the ability. He's given them the wisdom, the expertise, the specialism, and all that, and that resource is there. Uh, and it's so when you're praying for discernment, you're praying for sensitivity, you're praying to make sure that you go to the right person or the right resource and all that, so you just don't get sent left, right, and center. So I
Absolutely.
agree. I 100% agree. Now I'm gonna come to personal side. I just love your smile. I just love your
Oh,
smile. I
thank
love
you.
your smile. I know this is how you swept your husband off his feet. And even if he's angry with you, he's like, "Oh God, Catherine, can you just stop smiling? Can you just stop smiling?" Absolutely.
Oh,
Now,
thank you.
the power of representation. We've kind of alluded to what's happening to, or what happens a little bit more to those of us in the Black community. It doesn't matter where you are around the world, and we always hear about the power of representation in different fields and different aspects. And you per se, you've been on various platforms, the BBC Africa. Obviously, we met, I think, in the House of Lords, or I don't know, in some parliament, in some event, and all that. So I know that you're really one that believes that visibility matters.
Yes.
Visibility matters because, number one, women are watching. Number two, women, once they see you or see me or see anybody else, they're like, "Oh well, if she's talking about it, or if she can do it, or if she's being," like someone put in the chat, "Thank you so much for being transparent." If you're not transparent, you end up talking at people rather than talking with people. People need to know that the Bible says that Jesus had compassion because he felt what you feel.
Yes.
And so we have to, I mean, it's not that you need to kind of open up your whole life, but where it's relevant, people need to understand that I know what you're talking about, or I know what you're feeling because I've gone through it, or my mom, my child, or something, so and that's all part of the representation. So I want to ask you, why do you think that visibility matters, and what do you think, in your opinion, what do you think it means to women of color around the world, women watching you?
Thank you for that question, because it's the reason why we're even here today, speaking together as Black women. Um, it's very important to have a point of reference. Okay, as Christians, our point of reference is God. It is Jesus's life. And we just go to the Bible and read his story, because you will learn everything. He answers all the questions in life, right? That's our point of reference.
Yes.
When it comes to career, who is inspiring you in this world? When it comes to, even as a mother, who have you seen, or what experience have you had? A lot of us are, well, all of us are the fruits of our environment, with the result of what we've been around and experienced when we were growing up and
Yeah.
we were younger. But I look up to my mom, for example, when it comes to a mother. My mom is the best mom in the world, hands down. We can't argue that, but that's because I had a good experience as a child. I saw her giving everything. So automatically that, and I knew how it felt, it made me feel. And that's how it goes to what you
Yeah.
said. The
Yeah.
reason Jesus was coming from a place of conviction,
Yeah.
Jesus had compassion because
Yeah.
he felt what other people were feeling as well.
Yeah.
So when we're reading his story, we can relate to him because he's gone through it. Other
Yeah.
people in the Bible have gone through what we're going through, and that's why we relate to them. And
Yeah.
that's why we read about them and we acknowledge them, and we say their names when we're talking and giving people stories, right? So the same thing as well. Who is your inspiration? Who's your point of reference when it comes to you as a wife?
Mm.
Many women don't know how to be good wives because they didn't see good wives.
That's true. That is so true.
Many people don't go to the doctors because they didn't see good doctors.
That's true.
So I am here to show what my own version of being a good doctor is, my
Mm.
version of being a good mother is, my own version of being a good wife is, a
Mm.
good sister. This is my version. It's
Yes.
not the only version because God has created all of us beautifully, already
Right.
perfect. We
That's
have the tools. None of us is actually, we're perfected in Christ, but we are not perfect. So we have the tools to become more like him. We have
yeah.
the tools to refine ourselves, as we said at the beginning of this talk. How are we growing
Yes.
without any apologies? So
Yes.
for me, it's very
Yes.
important to be at the House of Commons. One, because I always saw it as woo is a big thing. I've
Yes.
achieved it by God's
Yes.
grace. So it's
Yes.
not impossible.
Yes.
And that's how the Mom's Pride community has grown. And the women will know that because of the story that I also have, which I will be sharing as I go along, and by God's grace, I'll write about it. I don't believe in your current situation being an obstacle for
No.
you to reach your destiny and for you to achieve your passions. I've always had the passion of being a doctor. So everything that happened in between was not going to stop me.
I
Right.
love
And
that.
it's not because I had anything more than anyone else, just your passion, your drive, filled with where you know, with who you are in Christ, you're unstoppable. You
Absolutely. I
are
love that.
unstoppable. So for
Love.
me, it's important to now
Love.
use my knowledge in my field. I am not a doctor who happens to be a Christian. No, I'm a Christian who happens to be a doctor.
I like that.
So I am going to use what I've been given and the
Yes.
knowledge, because I did not study for 1, 2, 3 years. I've been a doctor for 10 years now.
Yes.
So I have that experience. And even within our own community as doctors, we are still fighting the imposter syndrome. We are still forgetting that we've been doing this for the past 10 years.
Yes. Yes.
I didn't start studying 10 years ago. I became a doctor 10 years ago. So I have
Yes.
10
Yes.
years experience already.
Yes.
And
Yes.
within the NHS, unfortunately, we're still fighting the people that have been doing it for 20 years because they look
Yes.
down on us.
Yes.
How
Yes.
many times do I go to work and people are like, oh, you're too young to be a doctor? Oh,
Yes.
you look so young.
Yes. Yes.
Or they
Yes.
will not listen to me because she's the young doctor or she's
Yes.
the young
Yes.
girl. She
Or they don't
doesn't
think
know.
or you're not the doctor at all. They'll just think that you're some other, staff, that you're not the doctor, and they
Oh, no,
talk
no,
to somebody else.
100%.
Yeah.
I have my badge here to say, hi, up, this is Dr. Benhura. And by the end of the consultation, oh, listen to the nurse, darling. It's like, yeah, we won't go into that much, but we get that. Even
Yeah.
in hospitals, we get that
Yeah.
on our place of work,
Yes.
unfortunately. So we are fighting a lot. And the space that you will create for yourself is a big space already.
Yes.
I always say that even if there's one person that you can help today,
Mm.
you
Mm.
have changed the world,
Yes.
because you
Yes.
don't know the generations that are coming from that one person.
Absolutely.
You don't know who they're going to be in 5, 10 years
Absolutely.
time. You don't know
Absolutely.
if they're going to remember you and quote you in 5, 10 years time. While on
Absolutely.
this short time that I have on earth, I have to make an impact. I will not waste this time. I will not waste the fact that God has created me. It
Music
will
to my
not be a
ears.
waste.
The
It will
music to
not
my
be a
ears.
waste.
Music
Not
to
to say
my
it's
ears.
easy, Not to
No,
say that it is all glam and beauty, no,
no.
but diamonds are refined in the fire. And if
Yes,
you
yes.
decide to be
We
that diamond
finally
in your
fire.
field, you need to be ready to go through that fire. You need to be ready to go through that molding. And I'm speaking to myself as well, because challenges will come each and every day. But you need to represent yourself,
Yeah.
represent your community, and as a Christian, you represent Christ wherever you go.
I love this. I love this because so so many people, maybe people listening right now, or people that will listen to the replay whenever, it might be next year, I don't know, 10 years, 15 years ago, even whenever, or maybe when I'm gone and people are listening to this, there will always be obstacles. There will always be obstacles. We have a saying in my language, and my mom's in heaven. She's probably going to be laughing because I don't speak Igbo well, but I know there's this thing where they say that you won't, because of the fact that you might potentially be shot, you won't go for war.
Hmm.
So you won't, let's say for instance, you're going to be conscripted, or let's put it in Christian parlance, that life as a Christian, that you're going to be fighting wars, you're going to be praying, warfare prayers and all that. There's always, so you're not, because of that, you're not going to go for war. I better not, because I don't want to get slapped, because life is full of trials, and so we have to step forward whether we like it or not. And I always say this, not everyone's going to have a massive platform. Not everyone's going to be, at the UN. You're at the UN, you're a UN delegate, I'm a UN participant, CSW 69 and all that. And these are all amazing platforms. You meet other people. But what I want to say to you right now, whoever's listening to me, is look for your community. Look for your community. It could be two people, it could be three, it could be 10. Look for a place where you can make your mark, where you can make your impact. It could just be talking to your next door neighbor. It could be, it doesn't, you might think it's little, but you have no idea the impact it will have in somebody else's life. And, like you rightly said, Dr. Catherine, the people that are watching, generations to come, please, please, please move forward. The obstacles are always going to be there, whether
Yeah.
in the workplace. On Wednesdays I do the Power Through in 30 with two other amazing leadership coaches. This is just for women of color in leadership spaces and professional spaces, to help them move forward, help them get through all the various trials and tribulations, how to negotiate, self-advocate for yourself, and so many other things. And the stories are the same. It doesn't matter how high or how not high you are, the same challenges, but you're not going to do it because you have a challenge. You're not going to move, or you're going to give up. You're
Yeah.
going to give up. No, I absolutely like, thank you so much for saying that. I really, I really like that. I'm going to let you go in a minute, because I know you have to. I want to talk forever. Now, there's so many things I want to talk about, but I remember you're a wife, so I need to ask you some things about your personal side as a mother, as a speaker, as a leader, as a doctor, and so much more. As a woman of God in your local church, you pour out a lot. Like every other woman, you're pouring out, you're pouring out. Like they say, Jesus said the woman touched her, and he felt
Yes.
virtue, So you're pouring out a lot. What keeps you grounded and filled up?
Wow, that's a really good question. What keeps me grounded is my community. What fills me up is the love. Obviously, my best friend, my husband. He's
Thank you for letting
constantly
me have
pouring.
her today.
No, honestly, it is. y- Whenever you see a woman doing amazing in their field, know that her husband is supporting her.
Yes, yes,
And
absolutely. Yeah.
that's the real,
That is
that's
the
the
truth.
real.
That is
The
the truth.
fact that I can be here, he's looking after the kids right now. you know he's setting up all the stuff, and that's how he pours back into me as I pour into him. I feel Like there's also things that I also do for myself that I enjoy. I am actively doing that. For example, I'm blocking things out in my calendar because I am quite busy. So
Mm,
I'll block things out in my calendar to plan things with my children.
mm,
I love creating memories. I
mm.
love traveling. I love food.
Me too.
So I make sure that we go out.
He was raised in Italy, y'all.
Yes, I was. I sure was. I sure was. And I go back as often as I can. So I love relaxing as well. I know that I can't do it as much as I would want to
Yes,
because of how busy I am, and that's the
yes,
reality.
yes,
You
yes,
know,
yes.
as I got married and have more children, my time is tighter, but
Mm.
it is very important because I cannot wait till when I am breaking down in bed. Like, don't stay in bed because you're ill. Oh, let me know when I'm back.
Yes, you're back. You're back.
Can you hear me?
Yes, I can hear
Sorry, I
you. We
just
can
got a
hear you.
phone call through.
Yes, I can hear you. I can hear you. I can hear you.
Oh, hello.
Hello, hello. I can hear you. Okay, what I'm going to do is I'm going to take you out and push you back in. Maybe that will help because I can hear you, but you maybe can't hear me. Hello? Can you hear now? You can't hear. Oh, I think the call. All right. Okay, she's logged off and she's going to come back in. Hasn't she been amazing? Let's see. We know how to deal with every single technical issue now. Are you back?
I'm back.
Yes.
Yes.
It just shows that you are really smart because you figured out that, okay, if I can't hear you, let me log out and log back in. Yes, well done.
I thought that's the only one. But yes, without taking much of your time, I think it's very important to do what you enjoy and take time out to do it, but also don't stress if you can't do it as much. I
Yeah,
think I went for a period where I was really stressed, like, why can't I go to the spa every month like I used to? Because now other people need me. Now my time is different, but then I have to be even more active and more intentional in taking that time. So I do try and rest, and now I have to by force exercise because I better be doing what I'm preaching. So
yeah, absolutely.
so all those
Absolutely.
little things to pull back in myself and to renew my mind every morning. Like I do take that time to pray every morning. I have to renew my mind because I have to let go of certain things that just keep a hold on you. And as a doctor, then I also know how it shows in your own health,
Yes,
physical and
yes,
mental. So
yes,
that's why I said they're all very much intertwined.
yes,
And we want to live a beautiful life on this earth while we
yes, yes.
can. So
Well,
you
we
have to pull back in because you can't pour out from an empty cup, which is true.
absolutely. One of my famous sayings, I say this all the time. This has been absolutely phenomenal. I don't want to let you go, but we've got to be respectful so that you'll come back. If you want to reach Dr. Catherine, the amazing, phenomenal, incredible, beautiful, generous, passionate, committed, everything else, you can see her on Insta. It's on the ticker here, Dr. Catherine Benhura. And it's the same on LinkedIn, Dr. Catherine Benhura. And I'm also going to share with you if you want to know how to come to the community hub or you want to know more information about what they do. This is the website, and I'm sure there's a contact us page there. What I would advise very, 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 very strongly is follow them, follow her, follow them, find out what they're doing because very soon they're going to be in an area near you. 30 minutes. If you're not in the UK, I'm sorry, but don't worry. She's got, I've already prophesied it's going to be global. She's going to be connecting with other, um, medical professionals, clinicians, and holistic people like myself all over the world, and we'll be doing this kind of thing. And see, I'm saying we, whoa, and we'll be doing this kind of thing. Community health hubs in different places, in Italy, in France, in various states in America, in Africa, in Zimbabwe, and everywhere. So I want to say thank you so much. Let's see what people are saying in the chat. Oh, that's right. Faith without beauty and brains. Oh, people are just, the track's just going mad.
Oh,
You know. So I want to thank you so much. You
thank you.
know, I know. Yeah, I thank you for pouring out into all of us, including myself. I've learned a few things as well that I didn't know. So thank you so much, and I will bring you back. And I'm going to say it live, so you can't say no.
I would love to. Thank you so much for inviting me and for having me here. It's been amazing. I love to do this. I love to talk. So, I love to pour out. And yeah, thank you so much. You're amazing. Keep doing what you're
Oh,
doing.
oh,
You
thank
are
you
an
so much.
amazing woman.
Thank you
Very
so
welcoming,
much.
very approachable. So
Oh,
I
thank you
appreciate
so
you.
so much. Thank you. So I'm gonna let you say the last words. If you wanted to say one final thing, because I could talk until tomorrow and we'll be here till tomorrow. What will be that final one message you would want every woman listening tonight, or those that are listening later on, to walk away with?
You are powerful in your own. Okay, you are powerful, and I'm not saying it because it's cliche, but I do, and I say it all the time. You can help that one person. You also said it before, Dr. Z, that you don't have to have a big platform. You are a leader wherever you are. If you go to work, in your home, in your church, in your community, wherever you are, you can make an impact. So don't look up to people as they are unreachable. You be that person that can make that change.
Be that person. Be that person. I said I'm not gonna say anything. She said it. Thank you so much, Dr.
Thank
Catherine.
you.
Thank you so much. Oh my days. How do we end such a show? Oh my days. Oh my days. Please, if you could
Thanks
stay
for
just two
listening to A Cup of
seconds.
Tea with Dr. Z, your reinvention queen. We hope you've been motivated and inspired to go out there and conquer any obstacles and issues you may face. You can find Dr. Zena on all social platforms. Until next time, remember, you're not alone.